Hey everyone, today we have Dr. MVVS Srikanth. Srikanth, congratulations. First, you're the topper in this time's INI, AML, and CML rank 1.
Yes, sir.
So nice to have you with us.
Thank
This
you.
is going to be a very casual conversation, yeah. Hopefully, about your preparation to help others and
Yes,
about plans in the future in neurosurgery in general. We like to
sir.
get your support for other people who are going to come and follow you and maybe even become your juniors in 1 or 2 years. All right. And how are you, Shrikant?
I'm fine, sir. I'm feeling very happy.
Good. Where are you from, Shrikant?
I'm from Andhra Pradesh, sir.
Where
Kakinada in
in
Andhra.
Andhra? Kakinada. Yeah, I was
Kakinada.
brought up in. Yeah, I was brought up in Vizag. So,
Acha, acha.
కొంచెం
It's
కొంచెం
around
తెలుగు వచ్చు.
50 kilometers from there, sir, sea coast.
I know, man. I was in Vizag for 15, 16 years. So,
Oh, that's
కొంచెం
long.
Telugu వచ్చు. I understand Telugu, but
Ah,
speaking is a bit of a challenge these days. It's been a long time.
yes, sir.
So nice, yeah. And right now you're in Kakinada itself, or you're somewhere else?
Oh, sir. I'm in New Delhi, sir. I'm doing my
Okay.
senior residency in New Delhi currently.
Where are you in Delhi?
In AIMS Delhi, sir. I have done my
Okay.
PG from here.
Okay. Excellent.
Uh,
So you've joined as an SR there.
as a non-acad, sir, for time being.
Not a good SR. Perfect,
Yes,
yeah,
sir.
Shrikant. So possibly you will just continue with the same hostel, the
Yes,
same thing.
yes,
Anyways,
sir.
so tell us something about your preparation, Shrikant. When did you decide about neurosurgery and how did you go about it and everything?
Sir, I actually had some passion about neurosurgery, sir. I like about the brain, how it works.
Right.
I found it astonishing, sir. So I want to go further into that branch,
To
sir.
that thing.
So
Right.
in MBBS, I was so much interested in the brain and all the neurological examination.
Yeah.
And all, sir. I was interested from there, sir, but I thought about neurology, neurosurgery, but neurology, it's like a long-term disease. And
Yeah.
neurosurgery, we can change bring some impact on the patient outcomes. So
Very true.
that's why, yes,
Don't
sir.
let don't let my neurology colleagues hear that.
No,
Huh?
it's not like
Although
this.
I agree with
Offending.
you,
Yes, sir.
but don't say that to neurology. They get very irritated.
It's not like that, sir. I'm not offending them.
No. I'm just joking here. I have very close friends in neurology, and we keep discussing about this. That at least my neurology friend colleague once he wanted to see all the nerves. I was doing a vestibular schwannoma,
Okay.
and he once came to the OT and he says, I have been testing these nerves for years, but I don't know what they look like." So then,
Okay.
after 90% of the tumor was removed, you can start seeing extraarachnoidal all the nerves. Right? So I called him in
Yes.
to the OT. He changed in the microscope. He
Okay.
saw. I said, "This is lower cranial nerves. This is fifth, seventh. All of that." And then I said, "This is a small piece attached to the brainstem. Now I have to decide whether I want to just reduce it or take it off the arachnoid and the brainstem." And then he said,
Okay.
"Sir, if you'd shown me fifth and said it's seventh, or if you'd shown me lower cranials and said it's fifth, I would have believed you. What do I know? The only thing I know is you guys don't get paid enough for doing this." That's the one conclusion that I can make. Your decision
Okay.
making is much harder than ours. Very sweet of him.
Yes.
Anyways, so how did you go about your preparation, Shrikant?
Sir, I have started my neurosurgery preparation in around the final year, sir.
Okay.
Uh, I was doing from my junior residency from AIMS Delhi, sir. And final year, after my rotation in other super specialty branches, I have
Right.
started preparing, sir. I initially watched your videos on Marrow, sir, to get some idea of what neurosurgery is.
What yeah. Yeah.
Yes, sir. And all your lectures were very nice, sir. It is simple and easy to understanding, even from the basics
Right.
level. After your
Right.
classes, I wrote some notes about it, and after that, my senior suggested some Greenberg handbook.
Yeah.
So after completing your lesson, I used to read that Greenberg and get a better understanding of the topic.
Yeah. Yeah.
And finally, I have read, I have watched your videos, sir, and after that, parallelly, I read that green book also from
Yeah.
all almost covered all chapters.
Almost cover the chapters. That's
uh,
wonderful, yeah. Really
yes.
achieved.
After
And
that, my final exam came under my residency has completed around August, like that, sir. So
right,
after that, I'm left with 2 or 3 months hardly, sir. At
right,
that time,
right.
I have revised that Greenberg and your video notes also, sir. It has helped
Yeah,
me a lot, and I
yeah,
have also done some MCQs from doc tutorials.
yeah.
Uh, MCQs wise, sir. After that, I have given some grant tests. After that, it was like that, sir. Final exam was good. It was more clinically oriented, sir. They were
Right,
almost 90% questions were clinically oriented. They have given a scenario and asked
right,
something about that.
right.
It was like that. So your videos have helped a lot about getting the clinical idea, the case and
Yeah,
all, sir.
yeah.
Yes, sir.
That's very nice. And you did towards the end, you did most of your grand tests, and then went back and finished the questions. I'm assuming.
Yes, sir. I have mostly revised Greenberg so many times, sir, around 2 to 3 times.
Right,
That
right.
helped me. After reading it second time, I have got some idea. First time it's like dry, everything
Very
is
dry.
read. Every
Very
second or
dry.
third day, I forget that water topic.
Yeah,
After
yeah,
2 or 3 times, I have got some idea about what is what. And
yeah,
your videos were also easy and explainable. It has made me understand better and to the basics, sir.
yeah, yeah.
So with your petrol, I have got my engine started up.
I'm so glad. I'm so glad.
Thank you.
That's such a
Thank you
nice
so
thing to
much.
say. Thank you. Thanks for your appreciation.
Yes, sir.
What were the topics that you thought among the preparation that were harder in terms of, let's say, oncology, vascular, or
Yes, sir.
basic sciences?
I find some where spine topic is slightly difficult, sir.
Right.
But about the level of localization and all, you taught well, sir. The questions were mostly about localization
Right.
and what next step will you do. It was like that, sir. So, and about the spine, I found it slightly difficult, sir. And about the operative spines, I have no idea about how to operate the
Yeah.
spine.
Yeah.
Those last lessons in Greenberg, I have very little understanding about that, sir. Operative neurosurgery, that was
Right.
my weak place
Right. Right. Right.
because we
No,
have explored.
we're hoping to work on that. I've already made two lectures previously for an operative, including operative videos. Although you'll find a lot of operative videos online, but at least explanations.
MCQ discussion videos, you have covered some spine topics well, sir.
Yeah. Yeah. Yeah.
Yes, sir.
At, at least that time when I made the videos, I had covered almost all the available MCQ books. I had, of course, changed the
Okay.
question slightly, copyright issues. But now, since
Yes.
then, many new have come out. So we're going to make the effort to include all of those so that no question gets left. Um,
Yes.
and how was the paper? How do you think about the balance of the paper this time? Was it very hard? Was it very easy? What was the paper like?
It's easy, sir. Well, when we have basics strong, we can easily crack that paper, sir.
Right.
It was
Right.
not very high-fi, not asking about some very rare thing.
Yeah.
It was less factual and more of logic and how we apply if a patient present to us, how will we deal with it. It was like that, sir.
That's good. Yeah. It's very good.
Uh,
Uh,
Greenberg also, those main key points, those boxes have helped me revise better before the exam also, sir.
right. 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 And what about your interview? How was the interview? Yeah.
Interview went a little bit up and down, sir. They have
Okay.
mostly, I was the first candidate, so they started asking more on spine, which I was very weak.
Oh
Still, I
God.
could answer some of those and okay, answered most of the questions with some valid points, sir. So they
Can
have
you give
given
us
me good marks.
some examples? What did they ask? Just for my knowledge and the knowledge of others, so we can improve our lectures. What
They
kind of
have
questions did they ask?
asked, they have given, there were almost five questions, sir. Five
Yeah.
and five examiners have asked those questions. They have sat and they showed a case scenario and they have
Okay.
given an image and in that they have already also wrote those division points what to ask. In that slide only they have included the questions also, but after the reading they told to read the scenario and see the image and told what is the diagnosis, then what will you do, what complications do you expect, how will
Right.
the patient. But apart from those framed questions, they asked, they went differently, sir.
Right.
After I read scenario, they started asking something else about that. What do you think
Mm.
about that?
Mm.
Went on, sir.
Okay.
Basically, they have asked something about. They have kept one ventral intradural extramedullary cystic lesion in the cervical spine, sir. So you told that
Okay.
ventral. How it was like that, sir.
Yeah.
Brain they have asked very little about most of the went with spine only, sir. You told that ventral will be neurointrixis, so that I just told them like that. It worked well.
Right. It worked well. I'm so glad.
Yes.
So at least they want to see your mind application actually. What you're thinking and how you're thinking. The right answer
Yes.
is not the important thing, but
Mhm.
you then they'll ask you why this particular diagnosis. You can say there are more commonly found there. That means they want to know that you're
Yes.
applying yourself. Right. That's the
Oh,
main
yes.
thing.
Sir. More common will be the correct answer mostly.
More
So
common.
that
At least they know that you know that there is more common, so you studied. You've shown your knowledge.
yes,
That
sir.
is a good thing. Yeah. Excellent.
Yes.
And did you have any exposure in neurosurgery during your residency? You must know. AIMS, though, they I think have rotations, strong rotations.
1 year compulsory rotation policy, sir. We will get
Right.
around 1.5 month, 45 days in each super specialty branch. There are
Okay.
some compulsory postings like three. Neurosurgery is a compulsory posting, and
Right.
trauma surgery, and we can choose from other three like surgical oncology, plastic surgery, and GA surgery like that, sir.
Okay.
So I was interested in neurosurgery. It was a more hectic, sir, neurosurgery posting was.
Yeah. Yeah.
But still, I went with my instinct to choose neurosurgery, sir, despite of being hectic.
No, that's a life choice. There are many advantages, disadvantages to everything.
Yes,
I'll give you an example, and this is for everyone who listens. Um, you would think that onco-surgery, let's say there is no emergency, it's all elective. But
yes,
by the time you become head of onco-surgery in any hospital, no, it will be a long time for especially corporates because patients have time to choose which surgeon they want to get operated by. Until you
yes,
get bald head and white hair,
yes,
you will be a part of even if at associate consultant for a very long time. Same with cardiac surgery, same with urology, but neurosurgery, even if the prime minister or president is going near your small, even if you're in a small hospital and some attack happens and that they get brought to that hospital, there is no time
yes,
for people to fly in and operate them.
yes,
They will have
still
to get
not.
operated by you.
Mm,
Yes, you become the sole master. That's why I've operated on some of the people who I know would otherwise have not come. Ex Miss India, I've operated ex vice head of Indian Air Force who's retired, right? Used to stay right in front. That's only because they had certain emergencies, and
mm,
so that is one advantage. Disadvantages
yes,
is that I think family life balance definitely, but that goes with
yes,
transplant surgery also, liver transplant also, if you think of those
yes, yes.
things, and stress also.
Actually, my before interview only, I had marriage just a day before interview.
Oh, congratulations! Yeah, so nice. Yeah,
Thank
so
you.
sweet.
Why,
Yeah.
sir? And after the wedding, also that night also I have read neurosurgery.
That's so sweet, man. What does madam do?
She is a nursing officer here, sir, in AIMS Trauma Center.
Okay. Oh, yeah, oh, love marriage. Huh? Excellent. Yeah. So both of you are going to be there itself. Huh? That's a
Yes,
very
sir.
nice thing. And uh, and so what is your so you mainly prepared while you were doing your residency and your senior residency, right?
Yes, sir. In final year of
Prepared
residency.
in
And
final residency and you stayed there.
also after that, I have uh, started as a senior resident here around September ending. So I
Okay.
had a free time of 1 month in September. I utilized that. Even if after joining senior residency with allowing duties in free time, I used to read and try to
Great.
complete all the topics.
Excellent, excellent. And what would
Yes.
Shrikant, what would your advice be to someone who's just starting out to prepare? What is the sequence or how they should prepare? I know you've told your journey, but
Yes, sir.
including what you could have done differently. Could you just throw some light on that?
Yes, sir. I think while doing residency only, we should start to avoid any wastage of time after residency.
Right.
As neurosurgery is a long journey and we have to learn a lot lifelong. So
Yeah.
I prefer them not to waste time after doing junior residency. We think like चलो अभी एग्जाम हो गया उसके बाद पढ़ते फिर एक साल उसके बाद सीट
Exactly.
टाइम
Exactly.
try
Exactly.
in your junior residency only and
Yeah.
try to get into neurosurgery as soon as you want if you are passionate about it.
Yeah. Yeah.
Yes, sir.
So
And
that is
I
one.
think 7 to 8 months time is enough for preparation, sir. In finally, if we start in last 4 or 5 months, we read only general surgery for exam being for passing the exam. So that will go, and after that we can give attempt. Even after that, if we don't get it, we can join any job, and after 6 months also we can try for that. So.
That's great. Yeah. And
Yes.
the sequence of preparation you would recommend same as you, that do the
Yeah.
Marrow lectures, then Greenberg,
If
and
people are more interested, they can read their UG anatomy book, neuroanatomy first before
right,
doing starting any neuro preparation. So that neuroanatomy and neurophysiology, they get a basic idea and they will recall because after MBBS, it's almost 3 years, we forget everything about neuroanatomy as it is very dry subject. So
right, right,
I
right,
advise them whatever they have read the neuroanatomy their in their undergraduate level. Whether
yeah,
I have read Chaurasia in my first year MBBS anatomy, so I have read that neuroanatomy part first, and
yeah,
I have read my UG book, and after that I have started listening to your classes.
yeah,
With that, because neuroanatomy and neurophysiology knowledge is a must before starting neurosurgery preparations. So unlike other branches, we can directly start off with GI surgery
yes,
also start off.
yes, yes,
But for neurosurgery, we should definitely have that basics before
right,
starting neurosurgery preparations. Sir. Otherwise, we'll be confused all where.
right. And Shrikant, can you recommend what we can improve, increase in our lecture series now that you've gotten through and you're in the cusp of it?
Yes, sir.
What more can we do?
Yes, sir. I found the MCQ part of Marrow SS is very slight, sir. We should
Hmm.
improve. You should concentrate more on the MCQ parts because many people what they're doing is they see Marrow videos and they will do doc tutorial or such test app for MCQs and they give the exam, sir. If you could improve more in the MCQ parts, because I have done Marrow MCQs,
Hmm.
they were very less and
Very less.
uh, and the questions were more of a UG, same as the math PG
Hmm.
style question.
Hmm. Hmm. Right,
Into depth, and they have asked some very rare things also, sir.
right.
I think that is where Marrow should concentrate more, sir.
We do you
Videos,
You
sir.
do believe we should become more detailed in our videos? Because sometimes I actually can be more detailed, but I decide not to be, so that some people find it very harrowing. So,
Yes,
but for the MCQs, maybe we can be more detailed than what is already available, I think.
sir. I think videos part we will get the basics. Then everyone should read the Green Book textbook. It is a very nice and a short textbook, easy to
Yeah,
carry anywhere. And
yeah,
with that, I think if MCQs in MCQ, if we give explanation,
yeah.
they will revise the topic what they have read and what your classes told.
Right,
It will be get revised well in the MCQ part only.
right,
I
right,
think that
right.
will do the most things, sir. Because neurosurgery, most of the topics, most classifications and all, it can be covered in MCQ, sir. I think videos
Right.
are enough. MCQ
Yeah,
part should include, sir, and explanations also.
great. That's perfect feedback. Yeah, because we're going to redo all the lectures. Hopefully, in 6 to 8 months, we'll have a completely new set.
I think the spine topic should be covered more, sir, because this time I have seen many spine bits, almost around 7 to 8 spine bits were asked in interview. Also, they have asked C Vijay junction anomalies, and
Yes, yes, yes.
they have covered a lot, sir.
I'm glad you said that. Actually, what happened was that when we prepared the lectures, no, that time, even if you see the previous MCQ books, major concentration was on brain. Spine was mainly on localization. But now
Yes.
many neurosurgeons are dedicating themselves as neurospine surgeons. So they have naturally increased the focus on spine, especially as competition to orthospine department. They have especially tried to focus that no, you need to know spine extremely well as a neurosurgeon.
Yes, sir.
60% of our elective is essentially spine. So
Yes, sir.
it's a very good feedback. We will do much more on spine. Our
Yeah.
understanding has also increased, and I think operative, particularly, I'll try to include within the main lectures, especially some videos of myself and people who have promoted. And
Yes, sir. And also functional about functional neurosurgery. Also, a little detailed videos will be there, sir.
right, so
Yes.
epilepsy, functional, and spine will be
Not,
so has to be significantly increased.
not, sir. They have asked
Right.
about epilepsy in MCQ exam, and also in the interview also they have given some levetiracetam novel drug. Something I didn't know about that.
Must be brevetastam, so it's brevestam.
Levetiracetam they asked about.
That's come out. It's come out only in the last 2 years, essentially. When we made the lectures during the COVID time,
I haven't found it anywhere in the book also, so I
it's
didn't know about
clinical
that.
practice. It's now very common, especially for differences that levetiracetam is a 500 mg tablet, brevestam is a 50 mg tablet. Levetiracetam is still world over considered the best, but the point is when you have epilepsy in, let's say, teenagers, when it's usually starts, primary epilepsy starts often in teenagers or post-febrile seizures. It's easier in school for them to carry 50 mg tablets in their wallets or purses and all than 500 mg. It's also less embarrassing, so the compliance is more, particularly in more economically better like middle class and
Okay.
all that stuff, right?
About just dosage difference.
No, no, there is a difference in the compound also. Mechanism of
Okay.
action not very different, but they say that sedative effects are less of brevestam, although
Okay.
mood instabilities are a bit higher in brevestam.
Okay.
So basically, every time a new drug comes out, no, the companies push for it. So
Yes.
for us, it's like tried and tested. If any emergency situation happens, anything we need to know for sure that this is going to have an effect. Levetiracetam, sorry, is very safe in pregnancy. Is very very safe. So in Brevistam, what I like about it is that it's a very tiny pill and
Okay.
less sedative than
Mm.
especially in the initial first 1 week. Compliance is more. Other than that,
Okay.
anytime we have a doubt, we convert to levetiracetam. Anyways, we'll cover that. I didn't realize that they're asking questions about this because
They are.
this is basically changing pharmacology. Yeah?
Mm.
It's not supposed to be part of core knowledge,
Yes, sir.
essentially. But I'm glad you mentioned it. Now we can talk about the new age antiepileptics that have just started to come.
Yes, sir.
Right?
I think they want that we are up to date about
Up to date
yeah,
with latest things. Exactly, exactly.
yes,
So I interviewed your who is possibly going to be your batchmate yesterday. He was ranked 2, so he also said he most likely will come to AIMS. So
yes.
Srikanth, this was a wonderful interview. Any last words of advice to everyone who's giving exam?
I think if you want to be a neurosurgeon, don't hesitate. You should go for it.
Right, right. That's a good. I will always favor it. I always say that if you are interested in
Juniors, all many seniors they have discouraged me that what will you do with your life? There is no life after neurosurgery.
I
Many people
understand
said
that.
that, but I went with my passion only.
That's why when everyone asks, no, someone in general surgery will call up and say, "Sir, I want to talk to you about taking neurosurgery." I said, "Don't just talk to me. Talk to 5, 6 people. Two will be depressed, two will be very happy, and one will be moderate." But that's in
Yes,
every field. That's in literally every branch. Onco, if you see someone, they'll say, "Oh, why you want to? All my patients die." And then gastro, they'll be like, "We have to compete against general surgeons also." And then it's only the urologists are a bit happy, but that is if you enjoy urology. I did a lot of urology in MS, but I didn't even I have a thesis in kidney transplant. In fact, my MS thesis,
yes.
but still, I thought I wanted to work with more complex tissues and complex anatomy.
The
And
brain is never ending book, sir. We have to.
it's the frontier for surgical work. I think. See, there is new things happening in every branch. There's no doubt, but
Yes,
we
sir.
can essentially we can replace a lot of the You can replace the heart, you can replace the kidneys, you can do a liver
Yes.
transplant. With the brain, the issue is that now we are going into a phase where we can't replace it, but we can reattach it and revise it. So Neuralink has come out. In the future, we're
Yes.
going to see a lot of implants that have a brain machine interface, and it
Yes,
is
sir.
going to radically change the field, radically.
Yes, sir.
So yeah, patients with paralysis and ASIA grades, we might be able to control exoskeletons directly from their brains to be able to move around.
Mhm.
It is going to be miraculous work, and all of these implants are going to be placed by you and me, hopefully, right?
Yes, sir.
I would recommend to anyone the podcast with Elon Musk and the Neuralink team. I think the
Okay.
podcast was taken by, I forgot the name of the podcaster. He wears a coat and a black tie, and it's an 8 hour podcast, including the interview of the neurosurgeon
Okay.
who places the
Implant.
Neuralink implant, and many interesting questions, and including videos of what the implant is, how the craniotomy is made. They have the screws, how it's inserted by the robot, and it's very interesting. So through this
Okay.
interview, I'd like to for people who are just giving neurosurgery, and like Srikanth was saying, ki many people discouraged. I do think that the neurosurgery is the next frontier for significant
Yes,
surgical
sir.
innovation.
As,
Uh,
as you told, this is the century of brains.
Century of Brain. The Lex, now remember, the Lex Friedman podcast. I would recommend that people see the Neuralink Lex Friedman
Okay.
podcast. It's 8 hours,
Okay.
including 1 hour Elon Musk's interview, the interview of the person who is the biomedical expert who is heading Neuralink, and the neurosurgeon who implants the device. And it is frankly inspiring. We don't know how far it will take us, but this is what is coming up in neurosurgery in the near future. And definitely, those who are interested from the research point of view would love it. From the money point of view, yes, definitely. From the life work balance point of view, maybe not. But any super specialty field, right? Transplant,
Yes.
GI, onco, all of these have difficult life work balance issues, right?
Yes.
So, but I'm so glad, yeah, Srikanth, you were very sweet, and congratulations on your recent wedding. And
Thank you,
studying
sir.
through all that is a real challenge. I've done it. During my PG entrance, I got married. Everyone said I will not make it.
Okay. Okay.
You know, everyone said Dr. Nishant is getting married and he's not going to make it. He's too busy in his marriage. But then when I made it, those who didn't make it said that I made it because I got married, and
Yes,
responsibility
sir.
came.
I have done my wedding shopping after I have completed the exam, theory MCQ exam, sir. So,
Excellent, yeah, excellent.
yes, sir.
And feel free during your residency, anytime you need any help,
Yes, sir.
yourself and your batchmates, you have my number. And I'll ask Maro to give you my number. I'm in
Yes, sir.
Gurgaon, so any point of time you need any help, let me know. Right?
Okay, sir.
Uh,
Sure.
Wonderful to have you with us, yeah, Srikanth.
Thank you so much, sir. It's
And
my
congrats
pleasure.
again. Right? Thanks, yeah.
Thank
Thanks
you.
a lot.